That's right. I have met you. Yeah, yeah.
I was wearing a dress then.
Okay. Okay. Perfect. All right. Let's get started then. Today we have topic of post-mortem care. Okay. And I know. Yeah. So post-mortem care is usually the care that we provide when somebody dies, right? And sometimes this can be very sensitive, and there's also times when we're like, okay, what do I need to do as a caregiver, right? Because there's also nurses, like, what am I supposed to do? So I'm gonna go over that, kind of give you a clear understanding of what our roles are as caregivers when somebody dies in a unit like this, right? In a assisted living, right? Because you guys are considered assisted living, whether you work here with David or you work in Mary's building, you guys have the same guidance. Okay, so a patient dies over there, it's going to be the same guidance as you have here. Okay, kind of similar to what we do in skilled nursing, except we do an extra step in skilled nursing. Okay, so today we'll go over the importance of dignity, right? When somebody dies, how to provide dignity to the individual. And then there's also cultural stuff that are sensitive. There's certain people, there's certain religion that requires, or they may ask you to do certain things for the deceased, right? Because we're not going to call this individual who just passed a patient, right? It's somebody who just died, who passed away. Um, Again, you also don't want to use the phrase deceased in in front of a family member, because sometimes, even though that's the right phrase medically, um, or sometimes people use expired. You know, this patient expired.
I
So
don't like that term
yeah,
for
yeah,
people.
right,
Food is one thing, but
right.
not people.
But deceased, yeah, a lot of times though we just say somebody passed away, so that's a better, even in emails a lot of times. um some of the staff gets kind of like, somebody died and this and that, or deceased. You know, they don't like those terminal phrases. So just be simple with the family members. Somebody passed away, you can use passed away. And because some family members are very emotional too, right? And sometimes the death is not expected. Somebody who's in hospice, we expect them to die um, within that 6 month when they get admitted in hospice. That's literally what a hospice is. You have 6 months or less to live, right? And so when somebody dies outside of that time frame and there's no progressive decline, sometimes family members can get really spooked out. And any phrases you might bring out, it might spook them out. Okay. What's the role as a CNA versus, what the role is of an LVN or a nurse? We'll go over that. And then who confirms the death, right? Who confirms the death? And then the time of death. Let's, for example, you guys work in the middle of the night. The time of death is 10 o'clock. You know that the patient stopped breathing at 10 o'clock. It won't be at 10 o'clock though. It's gonna be when the nurse comes in. Okay. So if the nurse comes in at 11, the time of death can be 11 o'clock. Okay. So even though the patient stopped breathing at 10 o'clock, you know somebody has to confirm it, and that has to be one of the nurses. Okay. So just kind of um, some of the things that we do in terms of after a patient dies is that obviously we call the family member, let them know, and some of the phrases that we say to family members is also really important. Um, you want to say that, hey, this is Mary from assisted living or whatever. I'm calling you because your mom passed away. I'm so sorry for your loss. If there's anything I can do for you, we are here. Would you like to come by and visit us today? We will have Mary's body prepared or whatever, right? So those are just simple things that we can say to family members. Um, just be just be thoughtful of how they're feeling as well. Okay. Some of the things, the supplies that you might need in providing postmortem care is just your basic needs for taking care of somebody. Um, but the gloves is going to be really important. If you need gowns because you're dealing with a lot of fluids, maybe you can wear the gowns. But typically, all you need really is gloves, right? For when you're dealing with somebody who just passed and you're providing postmortem care. Okay. Um, and then other PPEs like face shield if needed, right? Just remember when an individual passes away, if they haven't had a bowel movement in a long time, all of these sphincters, right? You have a sphincter everywhere to prevent fluids from coming up. Like for example, you have a stomach, sphincter here. It prevents things from going up. There's some sphincters down here, prevent things from going down. You have one down here as well, right? But when you pass away, these sphincters that holds things together, they relax. right? And everything goes down. So yes, you might have somebody who pukes, right? You might have some stuff. If you repositioning a patient while you do postmortem care, you might have some fluids coming out of their mouth. You might have some urine coming out. You're definitely gonna have some bowel movement that's coming out. They haven't had a bowel movement in a while. Okay, especially if the death is sudden. A lot of times though, like when a patient is has died, they progressively decline, right? And they haven't had bowel movement and they're not eating for 4 or 5 days. But somebody who dies, um, suddenly, right? They were eating last night. Yeah, they might have a bowel movement, and this is why it's really important to do post-mortem care, right? When somebody dies. And I know this is a really tough subject to kind of talk about, but you guys are going to be running into it, or some of you guys have probably ran into it many times. And so, and we're still kind of like, hey, what is our role as a CNA, right? Um, go over that real quick. So right away, when somebody has passed away, the first thing you should do is you tell your nurse, right? You inform your nurse, hey, they stop breathing. Our nurse is gonna come by and we tell the doctor, right? If you have the ability to call the doctor because you're a med tech or whatnot, right? So do we do postmortem care right away? No, we don't do anything until the nurse tells you, hey, this is okay. The time of death is at this point and that time. Okay, we don't do anything for this individual. Do we start emptying Foley catheter? None of that, right? Sometimes too, like the death, if a patient has fallen within the last 72 hours, they hit their head and they died because of that fall, that could be a coroner's case, right? Instead of mortuary coming in, picking up the body, a coroner is going to come in, okay, and they're going to investigate, or the fall. How did the patient fall? If the patient died because of a fall, they're going to do an investigation. Okay, so that's why it's really important to find out if a patient died, has had a recent surgery, has had taken a different medication. Maybe there was an error in medication, right? So a few some of the questions that they would ask before you even do anything with the body is it a coroner's case? And if it is, don't touch the body. You're not allowed to touch the body. Okay, the police department will come by and pick up the body. They'll do investigation. Okay, but even if the patient fell down and died because of the fall, the nurse could still call the coroner's office and say, hey, this is what happened. She's in hospice. She did fall, 72 hours ago. But, I highly doubt that it's in relation to the death now. She was already declining, right? At this point, the coroner's office is going to tell the nurse, okay, here's a waiver number. You get a waiver number, and now you can provide care. Because now it's not a coroner's case. They've released the body, they've cleared the cases, right? But who's ever been in a situation where the body is a coroner's case and you can't touch it because maybe there was a wrong medication that was given last night, right? And they did it, and this caused the death. Or maybe there's a surgery that happened last week, and then now there's infection. Or maybe the patient fell, like I said, and has a broken hip, right? And now it threw a clot, right? Now you have blood clot, and then the patient died. These are things that could be in a situation that you're going to be in. And again, don't touch the body. It's a coroner's case. Okay. If we find out that it's not a coroner's case, and we confirm that time of death, and the family has came in, and or maybe the family is coming in, and we want to present this body, in a way that is comfortable for the family member. What is the position of the body you think you should put it in so that it's comfortable for a family member? Arms extended, right? Like this or like this? Like that, yeah, yeah, like that, yeah. Folded or extended, yeah, yeah. So it's supine on your back like this, and then you want to have that arms kind of just. You can put them right here too, but typically the best practice is you put them out like that, right? And then you cover them with a white sheet. You could if yeah, you could if your eyes are open and you want to close it, and then if elevating helps, the mouth is open and you want to elevate a little bit, yeah, you could do that, right? But the most important thing is when before the family comes in that you're providing the usual pericare, right? The pericare that you usually do, make sure you change the pads, you get a new gown on, you fix the face, right? You wash it with a washcloth and clean the hair. There's really nothing to it, right? It's just your usual pericare, except this patient has died, right? And so you want to present it to the family that they're clean. And usually what I do is I just clean the face and I clean the hair and I comb the hair because that is everything else is covered, right? So that's what I would do, and then change the pad and put a new gown on. right? Now, there's certain religions that might say, hey, you know what, I want these specific garments on, and we have to put that on. So some of the things that you could say to family members when they walk in, remember, just silence is really important because family members will come in and they'll cry and they'll sit there. And the best thing you can do, don't feel uncomfortable, is you can sit there and just be silent with them, and that means that you're understanding where they're at. You're being there with them, in the presence, right? You're not necessarily just yapping and talking. You don't need to, right? If they're not talking and they're just crying, you're just sitting there. You're being in the moment with them, and you're supporting them emotionally by just being there with them. Okay. Now you can say things. Oh, I'm sorry for your loss, ma'am. Is there anything else I can do for you? Is there specific things that you want on this resident, like clothing and stuff I can add for you, right? Just really simple stuff. There's no, but you do need to be there in that room. Just say, not the whole time. Just be like, hey, I can be outside if you guys need time with your loved ones. I'll leave the room, and then let me know when you guys are ready. But definitely, when they get there, just say, you're sorry for their loss. You can sit there for a brief moment and in silence with them if that's what they prefer, if they're not talking. And then, let them, a couple minutes later, you can say, hey, I'll give you some time with your loved ones, and I'll be outside. If you need me, please come get me. Okay, I'm here for you. Okay, those
So
simple
it
things.
is right to prepare them in front of the family because sometimes they don't want to go out.
If they don't want you to go out and they want you to stay there, that's totally fine as well. Just let them know, if you want me to be here, I can be here for you. You know, and some family, yeah, they want you to be there.
Yeah,
You know,
because sometimes they want to see the process and all that you
yeah,
need and then
yeah. Oh, when you're doing postmortem care, yes, the family can be there. They can be there, right?
they
When you're
be there
cleaning, yeah, they
as a
can be there.
ruling.
Yeah, and they want to see the cleaning part and this and that. You can ask if you're uncomfortable and you said, may I please ask you to leave, but they have all the rights to be there as well.
Yeah,
Okay.
they want to
Yeah,
know
yeah.
if it's something rude or
Right.
how they can take it because they're in the moment they're emotional.
Mm-hmm.
And so you never know how they can take, the process.
Mm-hmm. Yeah. Yeah. Absolutely. So if when the mortuary comes in, I don't know who's a med tech here. Everybody's a caregiver. Okay. A lot of times they'll look for a nurse or a med tech, and they want to know the time of death. And certainly we're not going to know that because the nurse probably has the time of death. But you can ask the nurse, be like, so what's the time of death? I mean, I know she stopped breathing at 10, and then you saw, and the nurse is going to tell you, oh yeah, time of death is going to be 10:30 or whatever, because that's when I saw him. And so, but yeah, you're not really going to be doing anything with the mortuary. Um, Mortician, they're going to come in, they're going to do their thing, they're going to talk to the nurses and the med tech, and they're going to take the body and go. Okay. Again, the only difference is that if the body is a coroner's case, okay, in which case then they'll come in, the county will come in, sheriff or whatever, they'll come in and pick up the body. Okay. As far as infection control, we're just using universal precautions here, guys. There's nothing special here. If the patient had COVID, yeah, you're gonna put in your PPE for COVID, right? Right? If they didn't, and you're just dealing with ordinary fluids, bodily fluids, you're using gloves and gowns, right? For the most part, it's just gloves, unless you're dealing with a lot of splashing, right? So, and infection control is just that. Okay. Um, does anybody have any questions on any of that?
Yeah. So the positioning and dressing the body or all of the above is the answer to the, or what are the CNA postmortem responsibilities? We don't do the applying the ID.
Which one?
Okay.
What number?
Yeah,
Number
just,
four.
it just.
Which of the following tasks are typically part of
Number four.
CNA postmortem
I
responsibility? Oh yeah, we don't do the applying of the ID tags.
With
Yeah,
A
sorry.
and B.
Yeah.
I am and B.
Yeah. So, and usually, just wiping down the body, just keeping it clean, with a washcloth.
And the five is the positioning of the deceased body is the supine with arms and legs extended, right?
Yeah.
Okay.
Yep. Yeah. Yeah.
And number one, I put two. Number two, I put rcfe, two nurse and physical. Number three, false.
Number two.
C.
Yeah. Yeah.
And three, false. Four, B. And five, B.
Mhm.
Six, false. Because you say that their
Mhm.
family can be. And and C.
Okay, yeah, the tube feeding when I insert tube feeding falls, and then the last one should be both B and C. Okay. Um, what are some of the challenges that we face as caregivers when somebody dies? Some of the questions that you might have, like what? I mean, you guys are pretty comfortable now, right? In terms of when what you need to say to family members. Usually, typically, it's gauge the family member. A lot of family members they're okay with it because they already know the patient is gonna die, right? They're already declining, right? We know that hey, my mom's probably gonna die within a couple days, and they've already prepared themselves. When they come in, they're even like relieved that the patient died because they've been suffering for so long, and so you can just say the right phrases and sorry for your loss. Your mom is ready for viewing or whatever. If you need me for anything, let me know. Okay, but always address the family members that are coming in, right? Um, let's see what else. Also, if the deceased is or the patient that died passed away, they're an eye donor sometimes, or they're a whole body donor, right? Family has gone through. Maybe they have a very complicated diagnosis, Alzheimer's, that they're trying to study. The whole body is going to be sent over to UCSD for a study, right? When you hear that, a lot of times you just need to put like ice over the a pack of ice over the eyeball, right? Because to preserve, because that ice they want that fresh, right? Because they might be looking at that and they might be studying the eyes as well. So just put a bag of ice over that. Put a cloth here and then ice over it. A bag of ice.
So the seventh question can be the C and B and D.
Which one?
7.
What's the question say?
Which item should be used to absorb post-mortem leakage? I'm not just saying.
No, just the
It's
pad.
C.
Just the
Yeah.
pad. Yeah, yeah, yeah.
It's okay.
Just the pad. Yeah, yeah. Yeah. No, I'm talking about if the body is they're donating it for science.
Oh.
You have to put ice over here to make sure that the eyeballs are fresh. Okay, because they are going to be
We
studying
haven't
it.
had any of them.
No, yeah. So there's two things that you guys haven't dealt with: a coroner's case, and then a whole body donor. So, but you will run into it at some point. Okay. Um, what's have you ran into a coroner's case or a patient who just died is a coroner's case?
Yeah, they have here, but that was
Yeah.
before my time.
Okay.
Yeah.
Sorry to interrupt you. Can you let me see the life enrichment radio? Sophia texted me that it's not in.
No, they misplaced it the other day and we can't find it.
All right, thank you.
Does yours say life enrichment on it?
Yeah, I think it does.
Yeah.
Yeah.
I didn't know it's been missing in action.
And
we're in a meeting here.
So sorry.
Yeah. So
The 8, which is not the part of the standard postmortem care.
eight.
Inserting the feeding tube is obviously.
Yeah, we're not gonna do the feeding tube. Yeah. And remember also, guys, if the patient is in hospice, make sure to call hospice. They're gonna do all the work for you. Okay. No, I mean like the nursing wise. We still gotta do postmortem care. Okay. But yeah, the hospice nurse will remove all of the tubings if needed. Right. We don't remove anything until the nurse gets here, or we're not even supposed to do it, especially Foley catheter. The nurse has to do that. And if it's a coroner's case, nothing gets removed. Nothing. Right. But if it's not a coroner's case, yeah, the nurse is going to remove Foley catheter, all of the tubings that's applicable that we can remove here. We just, remove it. All right. Any questions? I know it's kind of quick, but it should give you a good understanding of what you need to do when a patient dies, how to approach family member, how to prepare the body, right? Okay. And I have it recorded, so I can always just download it on. If you guys need to watch it. Okay. Okay. Yeah, it's only 20 minutes. Look at that.